Welcome to This is Public Health, a new podcast from the Illinois Department of Public Health. Each episode will look at a specific aspect of public health and the ongoing efforts to make Illinois a safer and healthier state. And for this first edition, we are pleased to welcome the director of the Illinois Department of Public Health, Dr. Samir Vohra. Director, thank you for taking the time.
Jim, an absolute pleasure to be part of this new podcast effort by the Illinois Department of Public Health.
This is part of the kickoff of a month-long observance, 30 Days of Public Health. What inspired that, and why is IDPH devoting this month of April to this celebration?
Well, traditionally, April, the first week of April, has been, through the leadership of the American Public Health Association, branded as National Public Health Week. However, almost 2 years now that I've been the director of the Illinois Department of Public Health, I have seen so many examples of innovative leaders, community leaders working and thinking about how we can all be healthier in our communities. So the Illinois Department of Public Health felt that 1 week was just not enough to celebrate all of the incredible work that's happening. So what we're doing is blowing out National Public Health Week, turning it into 30 Days of Public Health, where we are going to share the rich work that is happening, the deep history of our communities, and how public health has been so important here in Illinois, and also to bring awareness about the totality of all that is public health. Something that I don't think much of our audience or residents across Illinois really know and deeply understand, that almost everything in their community is tied to a feature of public health and how important it is in their day-to-day lives.
I know part of this is going to focus as well on careers in public health. So I'd like to talk a little bit about your background and what got you interested in the field of public health.
So much, Jim. And I think part of it just goes back to the very idea that I've always felt that public health is about community and it's about social justice. It's about taking all of the strands that are necessary, from clean air to housing to systemic disparities, and working together to uplift and make all individuals healthier. And part of that for me was a place where, when I was trying to think about how to do this back during my undergraduate days, I didn't really know if the right direction was to go into medicine or go into law. Because although I knew that health, I wanted that to be my focus, I knew that getting social justice and policy through was so critical as well. And so then I made, the decision that most people typically don't make, most sane people, is to do both degrees, to do a medicine and law dual degree, where I could combine that medical and legal training in an effort to tie those pieces together. I'm so deeply proud of being a general pediatrician and having practiced both on the south side of Chicago and the east side of Springfield. And part of that focus for me as a provider was trying to build brighter futures for the children that I cared for and their families. But then also very quickly realizing that many of the solutions that were causing their health not to be optimal was not in my control in the diagnoses that I would make or the treatments that I would prescribe. It was really based on the social and structural challenges that they were facing. And so before coming into the Illinois Department of Public Health, I focused my efforts in a university setting, trying to tie together both those community issues and the healthcare system issues that I was part of, chairing a innovative, what we called a social mission-driven academic department at Southern Illinois University School of Medicine, the Department of Population Science and Policy. And when I was given the great honor and privilege to be asked by Governor Pritzker to be the director of the Illinois Department of Public Health, I wanted to bring that into the agency, tying our public health system and our healthcare system together, being focused around social mission and social justice, and really tying those things together so that we could understand why certain people were healthier than others or unhealthier than others, and really combine across all of our policy levers in a real health in all policies approach to make them as healthy as possible.
You're listening to This is Public Health, a new podcast from the Illinois Department of Public Health. Our guest for this inaugural edition is IDPH Director Dr. Samir Vohra. Director, in talking about those issues of community, of social justice, that ties into a big project that happened last year as IDPH and the State Board of Health collaborated to develop the State Health Improvement Plan and the State Health Assessment. Talk about that in that 5-year blueprint that it lays out for what a healthy Illinois would look like.
We all know that in our very recent history, right? And we're all sort of still recovering from the challenges of a once in a century pandemic that really elevated the infectious disease part of public health into all of our lives. We couldn't escape thinking about COVID, thinking about things like contact tracing and social distancing and the need to be immunized for a unique and novel virus that affected the entire world. Now we're in the midst of recovering from that COVID-19 public health emergency and setting a new trajectory of what we think is critical for our state to be healthy and as healthy as possible in a 5-year period. So we submitted this state health improvement plan in 2023. We're calling it Healthy Illinois 2028. And it focuses on 5 core areas where we want to build progress around in Illinois. And we take those 5 areas within the context of systemic issues and sort of public health infrastructure issues that tie all together. So what are those 5 things? Number 1, it's chronic disease. We know things like heart disease and cancer continue to be the biggest drivers of our worsening health outcomes. Number 2, COVID-19 and emerging illnesses. We know that new and different things will come up, things that we haven't seen for a while may reemerge. And right now, as you hear this podcast, the state of Illinois is working very closely with the city of Chicago around a measles outbreak, the largest measles outbreak that we've had in nearly 15 to 20 years. Number 3, maternal and infant health, knowing how critical it is to address the disparities, not just when somebody's born, but when a pregnant person is ready to have a baby. 4, mental health and substance use. We know that that has been a continued challenge and an even a bigger challenge since the COVID-19 pandemic. And number 5, racism as a public health crisis. Elevating that issue, knowing the disparities that we see across the state of Illinois and really addressing those inequities and creating a more equitable state. Now, those 5 core issues tied into critical public health infrastructure things like workforce, data modernization, thinking about social issues like education and the economic development, tying that all together because we know that if those things aren't taken care of, we won't be able to affect and improve those 5 core areas. Focusing on infrastructure to lift all boats and seeing those specific community-built, community-led solutions to getting to a healthy Illinois 2028.
You mentioned the lingering effects of the COVID-19 public health emergency. How do we take what we learned during that time and apply it to that 5-year plan and to the challenges that IDPH faces going forward?
The most important lesson for me is that biologically a virus that should have affected all of us in the same way didn't. We knew that there were certain groups of individuals, both in urban and rural contexts, that suffered deeper challenges, sometimes grave health challenges, even death, compared to others, right? And a reminder at times, even right here in Illinois, that more important than even your genetics or your environment is your zip code in what determines how healthy and how long you have lived compared to somebody else. And so we have to focus around these social and structural issues in our society to get to the better health outcomes. And also a reminder that certain things. How do we modernize our information so that government is as adept as many individuals in many organizations in the private sector? How do we focus on the people who every day are our public health heroes in a public health agency, in a community-based organization, in a healthcare center, who are dedicating their lives to making all of us healthy, making sure we take care of them like they take care of us, and really working together to make sure that the public health system is strong for the next emergency, but also in the everyday things that matter to our health.
Many people listening had public health front and center in their minds throughout the pandemic, probably less so since then. For that audience, why should these efforts matter? What does a healthier Illinois mean for the overall strength of the state?
Well, I think simply, right, when we talk about public health, right, it's the making sure that the air we breathe is safe. It's making sure that we have the walkways and the parks that allow us to have recreation. It's having that special core time with our loved ones, friends, and family that make our mental health and mental wellness strong. And it's about making sure that all aspects of our community are tied together, because one of my core beliefs is that in order for us to be successful and happy and fulfilled, one of the core tenets that we all have to care about is making sure that our body, mind, and spirit are well. And that for me is health. And that for me is the core foundation of public health. And yes, often you notice those things and you notice the challenges when there is a public health crisis. But there are people every day making sure and protecting that health and wellness so people can enjoy their lives, enjoy their loved ones. And one of the things that we want everybody to think about and elevate is how important that is on an everyday basis to keep safe, to keep protected, and to know that we in public health are taking care of you so you don't have to think about it. And that is something that we need to cherish and we need to bring and keep strong, because our goal here, your health, is our priority in the state health department, and your community's health is our priority. And we can only do that when all of us engage in how important the public health system is and how much all of this to build to a healthy Illinois 2024 or a healthy Illinois 2028 depends on all of us working together to achieve those goals.
We are out of time. Director Samir Vohra, Illinois Department of Public Health, thank you again for your time here, for joining us on this inaugural edition of This is Public Health.
Well, thanks so much, Jim, and we're looking forward to these podcasts continuing into the future.
Tune in every week for a new edition of This is Public Health with the Illinois Department of Public Health. Thank you.